The test item cluster for mechanical neck pain that benefits from thoracic manipulation includes symptoms lasting less than 30 days, no symptoms distal to the shoulder, looking up does not aggravate the symptoms, an FABQ of physical activity score less than 12, diminished upper thoracic spine kyphosis, and cervical extension range of motion less than 30 degrees. The test item cluster for full thickness rotator cuff tear includes the drop arm test. Lower your arm slowly for me. Good. A painful arc sign where the patient is instructed to lift their arm just like that and down. And I would note any pain during that motion. And the infraspinatus muscle test. So push against my arm. Don't let me push, don't let me push. Good. And the test item cluster for subacromial impingement also includes the painful arc sign and the infraspinatus muscle test, which were just demonstrated, as well as the Hawkins-Kennedy impingement sign. And I would also note any pain with that. This is the test item cluster for mechanical neck pain that benefits from cervical manipulation. Symptoms lasting less than 38 days, a cervical rotation range of motion difference of 10 degrees or more between each side, the expectation that manipulation will help, and pain with posterior to anterior testing of the cervical spine. The test item cluster for cervical radiculopathy includes less than 60 degrees of ipsilateral cervical rotation, a positive Sperling's test, a positive distraction test, let's get to that for me, and a positive upper limb neural tension test for the median nerve. This is the upper limb neural tension test for the radial nerve. This is the differential diagnosis for radiculopathy and shoulder impingement or rotator cuff tear. First, I would screen for a present radiculopathy by performing a Sperling's and distraction test. If either were positive, as well as pain and weakness in a dermatomal and myotomal pattern, I would suspect a radiculopathy. I would then differentiate between a shoulder impingement and rotator cuff tear by performing a drop arm test and a Hawkins-Kennedy test on the patient. If the drop arm test was positive, I would suspect a rotator cuff tear. If the Hawkins-Kennedy test was positive, I would suspect a shoulder impingement. This is the Hawkins-Kennedy test for impingement. This is the active compression test of O'Brien. Don't let me push you down. And don't let me push you down. This is the Kim test or biceps load test 1. This is the apprehension or crank test for anterior shoulder dislocation.